South Africa's first coronavirus case was reported in March last year. Since then, there's over 1.5 million confirmed cases. A trio of female professionals in the healthcare system held a discussion reflecting on the role of women in the fight against the pandemic.
We quickly realized there were shortages. There were lots of shortages, PPEs. There were shortages of reagents. There were shortages of testing kits. And, now we're learning we're at the end of the queue for vaccines. So I think the key point, I hope the lesson we learn in taking this away is how much more we need to be investing in our healthcare delivery systems to ensure that we have equitable access to healthcare across the board. And we have a long way to go in terms of reaching that goal.
Over 107,000 healthcare workers have been vaccinated during the first phase of the vaccination rollout, but there are still uncertainties.
Our economy's taken a massive knock. We're tired. Speaking for myself and all the healthcare workers I work with, it's a year down the line, literally, almost a year, and we are tired. It's still us. It's still the same 10 people on the front line in the hospital where I work. But the question is what's going to happen next. So are we going to get vaccinated and not see a third wave? Is the third wave coming our way anyway? That's, to me, the major question.
It was really a tough situation, but end of the day, someone needs to do it. And then who else can do better than nurses? So the interaction between the families was quite a game changer, because when you're in the hospital, you have to comfort the patients. You have to wear different kind of hats, because remember, there would be no social worker, no psychologist in that unit if you're working in the wards. So when you're there, you are to be a counselor. You have to actually wear all different kind of hats.
The healthcare system was also lauded for its work in countering what could have been a far worse scenario. Simpiwa Makanya, SABC News, Durban.